Hello, and welcome to the IDF State Advocacy Workshop for Michigan. We're really excited to have you joining us, and we look forward to your advocacy on September 1st in your state legislature. In order to influence policy in Michigan, you must first be familiar with the policymaking process in your state. The Michigan State Legislature is a bicameral body consisting of two chambers, the Senate and the House of Representatives. There are 110 members in your House of Representatives and 38 members that serve in your Senate. Senators are elected at the same time as the governor and serve 4-year terms concurrent with the governor's term of office. Terms for senators begin on January 1st following the November general election. Representatives are elected in even-numbered years to 2-year terms. Michigan is one of about 10 states that has a full-time legislature. Other states have part-time legislatures, which means legislators in those states have other jobs in addition to their legislative duties. In your state, legislating is the member's full-time job. The legislature convenes for 2-year terms, and this term is split into 2 annual sessions. The legislature must convene each session by the second Wednesday in January. This means that the 2021 session that began on January 13th of 2021 will adjourn on December 31st of 2021. But the 101st legislature, of which the 2021 session was the first half of, will end on December 31st of 2022, after which a new term will begin. Next, we'll go through the legislative process in Michigan of how a bill becomes a law. Many of you are probably familiar with Schoolhouse Rock, so much of this will sound familiar. First and foremost, a bill is introduced. A legislator is brought an idea of something they think could better their community or residents of the state, and they decide it should become a law. They have this idea drafted as a piece of legislation, also called a bill. First, the bill is introduced and goes through title reading. This is exactly what it sounds like. It is read orally on the floor of the Chamber of Origin. The Chamber of Origin is either the Senate or the House, depending on if the legislation is being introduced by a senator or a representative. After introduction, the bill receives first and second reading in the Senate or first reading in the House. Once a bill has been read, it is then referred to a committee for review. The committee then considers the bill, which may entail a public hearing. This would be your opportunity to engage in the legislative process. Public hearings on a bill are open to anyone and everyone with an opinion on how a piece of legislation can impact them or others in their community, and they can make their voice heard. This is where IDF typically encourages our advocates to engage. Next, if the bill passes successfully through the committee, it then moves on to general orders or second reading in the Chamber of Origin. General orders, where the Senate resolves itself into the committee of whole, or second reading in the House, are to consider the standing committee recommendations on a bill. The bill then moves to third reading in the Chamber of Origin, where a vote is taken on the legislation. If it passes third reading, it is then referred to the other chamber, where the 3-reader process is repeated. If it passes successfully through that chamber, it then moves on. If the second chamber amends the legislation, it is returned to the Chamber of Origin to consider those amendments. If changes made in the second chamber are rejected, it is sent to a conference committee to resolve the differences between the 2 versions. Once the bill passes out of the legislature successfully, it then goes to the governor, who can take a few different actions that lead to the bill becoming a law. We'll discuss those actions on the next slide. So who is the governor of Michigan? The governor of Michigan is Gretchen Whitmer. The governor is the head of the executive branch. As we discussed, all bills that pass through your state legislature go to the governor, who can sign the bill into law, allow it to become law without their signature, or veto it. Upon receipt of a bill, the governor has 14 days to sign or veto the bill. If the bill is neither signed nor vetoed, the bill becomes law 14 days after having reached the governor's desk if the legislature is in session or in recess. If the governor vetoes a bill while the legislature is in recess or session, the legislature may override that veto by a 2/3 vote of the members elected to and serving in each chamber. The bill would then become a law in that way. The next person in a position of importance for your legislative process is Jason Wentworth, who is the Speaker of the House. The Speaker is the highest ranking officer in the House of Representatives and is elected by the House members themselves. You elect your representatives, and your representatives elect who leads their chamber. Lastly, we have the Speaker's counterpart in the Senate, also called the Senate President. In Michigan, that individual is Aric Nesbitt. Like the Speaker of the House, the Senate President presides over their respective chamber. They also oversee the appointment of committee members, assignment of bills, and progress of legislation through their chamber. As you can imagine, these individuals hold great power in the legislative process of your state. Now that we've talked about your legislature's makeup and the legislative process of how a bill becomes a law in your state, let's get into what you're going to be discussing with legislators on September 1st. This year, we're focusing our state advocacy workshops on the creation of rare disease advisory councils. A rare disease advisory council, or RDAC, is a body with the purpose of giving individuals with rare diseases, like those with primary immunodeficiency, a voice in their state government. It allows these individuals on this advising body to give recommendations to policymakers on critical issues related to access, coverage, and the diseases themselves. RDACs look different in every single state. However, they all share a common goal. They also all have very diverse memberships. And while these look different in every state, they can all include individuals such as patients and caregivers, health department officials, healthcare providers, and healthcare industry representatives, among many others. The establishment of an RDAC in Michigan is essential to ensuring the unique needs and interests of those in the PI community, among other rare disease communities, are understood and considered by state policymakers. Fortunately, legislation has been introduced in Michigan to establish a rare disease advisory council in your state. How did we get here? The movement to establish rare disease advisory councils in every state gained significant momentum since the first council was established by North Carolina in 2015. There are over 7,000 rare diseases, including over 400 primary immunodeficiencies. This means it is very difficult for state policymakers to have a full understanding of the rare disease community as a whole and the issues relevant to it. This lack of understanding by state policymakers contributes to common obstacles that I'm sure are very familiar to those of you watching this training, including delays in diagnosis, misdiagnosis, lack of treatment options, high out-of-pocket costs, and limited access to medical specialists. RDACs help bridge these gaps in knowledge by serving as an advisory body and liaison between the rare disease community and state governments, helping to evaluate and offer recommendations on health-related policies and issues. If and when the legislation currently being considered in your legislature becomes law, Michigan will be joining 20 other states that currently have rare disease advisory councils. The legislation currently being considered in Michigan legislature seeking to create a rare disease advisory council in your state is House Bill 4654. The bill was introduced in April 2021 by Representative Clemente and outlines the membership, responsibilities, and other details of the proposed Michigan RDAC. What will this Rare Disease Advisory Council in your state look like, and what will it do? As outlined in the legislation, the Michigan RDAC will exist within the Michigan Department of Health and Human Services. It will, as we discussed, act as an advisory body on rare diseases, including primary immunodeficiency, to the legislature, the Department of Health and Human Services, and the governor. As you can see, this is a very impactful body and very important in your state to ensuring that rare disease voices are being heard by policymakers. The membership of the council is still being negotiated, but it will likely include individuals with rare diseases or their caregivers, researchers who specialize in rare diseases, healthcare representatives, healthcare professionals with rare disease expertise, and representatives from rare disease patient organizations in the state, among others. Responsibilities of the Michigan RDAC will include researching and identifying priorities relating to the cost, quality, and accessibility of treatments and services provided to people living with rare diseases in Michigan, and developing policy recommendations on those issues. Identifying best practices for rare diseases from other states and at the national level that could improve the education, care, and treatment of, and supports provided to individuals with rare diseases in Michigan, and coordinating with other rare disease advisory bodies, community-based organizations, and other public and private organizations on research, diagnosis, and treatment of rare diseases. It's important to remember that even if you do not have a seat on your state's Rare Disease Advisory Council, you still have the opportunity to engage with them and affect change in your state. Now that you know there is legislation being considered in your state legislature to establish a Rare Disease Advisory Council, how do you discuss it with your elected representatives on September 1st? During your legislative meetings, you have two goals. First, of course, you'll be asking them to support House Bill 4654 to establish the Michigan Rare Disease Advisory Council. Currently, there is only legislation in the House of Representatives, but this doesn't mean you can't or shouldn't be discussing it with your state senator as well. We want to ensure this issue is on the Senate's mind as well, since, as we talked about when walking through the legislative process of how a bill becomes a law, once the bill successfully passes through the House of Representatives, it must then also pass through the Senate. Additionally, we're also going to be educating them on what primary immunodeficiency is. Many legislators, as we discussed, have a gap in knowledge when it comes to rare disease communities, including ours. We want to fill that gap on September 1st and talk to them about what people like you in their community deal with every single day in Michigan. What are some important points to make when talking with legislators? You're going to want to talk about the fact that primary immunodeficiencies are a group of more than 400 rare chronic disorders in which a person's immune system functions improperly. There are approximately 250,000 people in the country who are diagnosed with PI, and thousands more go undiagnosed. In Michigan alone, there are an estimated 7,700 individuals living with PI. Additionally, you're going to want to talk about the fact that there are over 7,000 rare diseases, including those over 400 PIs, meaning it's impossible for state officials to have a thorough understanding of every rare disease and the issues relevant to its community, which is why the fact that they're considering legislation creating an RDAC is so important to give a voice to those communities. By including individuals on the RDAC who are expert in various rare diseases, it's going to improve the overall quality of life for rare patients in Michigan like you. Lastly, the establishment of this RDAC will help ensure the unique needs and interests of those with PI and other rare disease communities are understood and considered by the state's government. If you forget any of these points, don't worry. IDF has created handouts for each of your two talking points. These handouts are available in your participant portal for your viewing before and during your legislative meetings. The handouts will also be emailed to the elected representatives with whom you'll be meeting, so they'll be able to reference them during your meetings as well. Now that you know about the legislation you'll be advocating for, let's hear a few words from our bill sponsor, Representative Cara Clementi, on why she introduced this bill and how important it is for those living with rare diseases in Michigan.
Hello, I'm Michigan State Representative Cara Clementi, sponsor of House Bill 4654, which would establish a Rare Disease Advisory Council in the state of Michigan. Over the past several years, I've learned firsthand from advocates like you just how challenging it can be to access adequate support and care when faced with a form of primary immunodeficiency or other rare disease. With the help of your coalition building efforts, a conversation around adequate representation, as well as research and treatment options, is opening up in our state. I'd like to acknowledge and thank you for your courage that you've shown as we work hard to advance this legislation, and please know I will continue to be an ally for this ever important cause.
Thank you, Representative Clementi. Now to Becca Russ, who will give you tips for effective advocacy on your day of action.
Thanks, Jamie. So now that Jamie has walked you all through the issue that you're going to be talking about on September 1st, as well as giving you an overview of your state's legislature, as Jamie said, I want to walk you through some information about effective advocacy to help you all be as successful as you can during your meetings on September 1st. So let's first dive into some information about your legislative meetings. So I just want to walk you all through some information that you should be keeping in mind prior to the day of action, as well as during and after that day of action as well. So prior to the day of action, so these are just a few things that you want to make sure you're checking off your to-do list before that September 1st day arrives. So first, review the materials that we have provided on the Michigan State Workshop webpage. So Jamie gave a great overview of the issue and the legislature, but we also have even more information about those topics on the webpage. So we would really encourage you to check that out. And we also have a tool that can help you identify your representatives in Michigan if you don't already know those. So that's another great thing to check out as well before that day of action arrives. Additionally, be sure to review your schedule of meetings before the day of action comes around as well. So we will be sending out an email to all participants from IDF that will include information about how to access and view your schedule. So if you do not receive any kind of email or information about your schedule by August 25th, please do reach out to us. We'll help you get that figured out and make sure that you receive your schedule. And basically, we just want you to look over it and make sure that there's not going to be any conflicts and that you'll be able to attend all the meetings on your schedule. And then lastly, if your schedule indicates that you will be joined by other advocates, which most of you will, we try to pair up individuals in groups of 2 or 3, try to coordinate with those group members ahead of the day of action. So, this is just a great opportunity to connect with those individuals, figure out who is the constituent for each meeting and who might want to share their personal experiences during meetings. So if you're interested in connecting with those group members ahead of time, please don't hesitate to reach out to us. We have contact information for the participants, and we are happy to share that if they allowed us to. So the day of action has arrived. What should you be doing before you hop onto your legislative meetings? The first thing is to ensure you're joining those meetings 5 to 10 minutes early. Especially when you have other individuals in your meeting groups, erring on that 10 minutes early side really gives you plenty of time to make sure everything's organized, everyone has, connected well and all of that before that office joins the call as well. Additionally, during that time that you join early, this is a great time to designate a call leader. And essentially, this person is going to be guiding the call as you meet with the legislator or their staff. A great person to be this leader is if someone is the constituent of the office. It's always great for them to contribute a lot to that meeting. Or if someone has really great personal experiences related to this policy issue that they want to share, that can be someone who contributes a lot to the call as well. And then lastly, before you hop on your meetings, be sure to identify the name of the staff person or the legislator themselves that you will be meeting with. Later in the presentation, we'll show you how to find that within your online portal, but just be sure to go into that meeting knowing who is on the other end of the line. So during your legislative meetings, just some things to keep in mind as you're talking with your legislators and their staff. So start off your calls by clearly introducing the participants and explaining what the mission of IDF is. And this is where that call leader is really going to come in. They'll guide the call and introduce everyone who's on the line. Also, have the individual that you're meeting with introduce themselves as well. It's great to kind of start that rapport and get introductions out of the way first. Then go ahead and dive right in. Start briefly describing the issue that you're advocating for. As Jamie said, we have talking points on your portal for you, so be sure to have those up during your meeting and reference those, share those facts with the office that you're meeting with. Additionally, sharing your personal experience and stories really helps emphasize the importance of this issue. As Jamie said, this is a bill that is really important to the PI community and other rare disease communities as well. So be sure you're sharing how this is going to impact real people like you. Then kind of end that call by clearly stating the action that you're asking the legislator to take and offering IDF as a resource. So you really want that person on the other end of the line to end the call knowing exactly what you're asking the legislator to do. And then last but not least, make sure you're saying thank you and showing your appreciation for their time. So you have finished the day of action, your meetings went great, you're feeling good. What should you do after the legislative meetings and the day of action? So in your online portal, you will have access to not only your schedule and other tools for the day of action, but also to the contact information of the staff and the members that you met with, even after September 1st. So we just ask you to please put this information to use. We will be sharing with you after the day of action a sample thank you letter that you can send to these offices. So just be sure to use that thank you letter and send it out to the offices, just showing your appreciation for the time that they spent talking to you. And not only are these thank you notes polite and just a courteous thing to do, they also allow you to present the ask again and make sure that the issue of the Michigan RDAC is at the front of their mind. And then lastly, we just ask that you help us do our follow-up as well by providing thorough meeting notes about what happened during your calls in your online portal. So later in the presentation, there's a walkthrough of the portal and you'll see where you'll be able to take those meeting notes. But just be sure to be thorough. If the office had any questions or requested any information, anything along those lines, just be sure to mention that in your meeting notes so we can follow up with them as needed. And then just some general virtual meeting pointers to be keeping in mind as you're going through your meetings on September 1st. So prior to your calls, make sure that whatever technology you're going to be utilizing is in working order. So whether that's your cell phone, laptop, tablet, just make sure that's booted up and ready to go. Also, as with any meeting, just make sure you're in a quiet location and that all of your electronics, such as cell phones and TVs, are turned off. We don't want anyone's phone ringing in the background by accident. Additionally, make sure you avoid multitasking, just stay 100% focused on the meeting. And above all, just be courteous and speak clearly into your phone or laptop. And then last but not least, again, don't forget to say thank you and show your appreciation. So now that we've kind of gone through what you can expect for your legislative meetings and the day of action, I want to share just some general advocacy tips and tricks that you can utilize not just for this workshop, but also in any future advocacy you may do. So first and foremost, just remember when you're advocating how much your voice matters. So you have a tool that lobbyists just don't have, which is your real personal stories and experiences. And by sharing your experiences like you will be on the day of action, you are showing that these policies and laws that your officials are making are going to impact the lives of real people like you. So as I said earlier, you're really putting a face on this issue. Additionally, when you meet with your legislators and make your voice heard, you create these connections with them, which in themselves is a great thing. It's great to have a relationship with those who represent you. But it also shows, that they may consider this issue when they may not have in the past. So if you bring this to their attention and show that you have a personal connection to this issue, they may be more inclined to support it. And then lastly, as a constituent and a voter, just remember that these legislators have a vested interest in addressing your concerns. So making your voice heard is a good thing for all parties involved. So telling your story virtually, just some things to keep in the back of your mind whenever you're telling your story. So using your own authentic voice, especially when you're sharing your personal experiences, is a great thing. Also, sharing clean, logical arguments that help make a solid and persuasive case is something else you want to make sure you're doing. As we've emphasized, telling true stories and using personal examples to really show how it's impacting real people like you. Always ask for the outcome that you want and make sure they're leaving the meeting knowing what action you would like them to take. And then lastly, again, thank them for their time. So if after participating in this workshop or, watching this presentation, you're thinking, hey, I'm really interested in advocacy. I would love to get more involved with IDF and advocate for the PI community. We have laid out some of the options that we have, among many, that you can use to get more involved in IDF advocacy. So there are so many ways to advocate for people with PI, and we've listed a few here for all of you. So first, which is exactly what you'll be doing when you meet with your legislators, is sharing your stories and experiences with policymakers. Can't emphasize that enough. You're putting a face on the issue. Also, testifying at hearings in front of committees, working with other patient organizations who have similar goals to IDF on health access issues, mobilizing other members of the PI community itself. We can never have enough advocates, so that's always a great thing. Also, responding to action alerts. This is a really quick and easy way to send a message to your legislators about an issue. And then lastly, good old-fashioned emailing, writing, and calling your officials to just urge them to take action on an issue that's affecting those with PI. Also, we wanted to mention that there are a lot of downsides to the virtual world we're living in nowadays, but a really good thing is that it's very easy to schedule a virtual legislative visit with your officials. So we've laid out here just a little bit of information about how you can go about that. And just want to mention that we are always here as a resource as well. If you're interested in meeting with your officials more regularly or need help scheduling a visit, we are happy to help you through that process as well. And then obviously you're all aware of our state advocacy workshops, which is one of the many ways that you can get involved with IDF. But we've listed some of the other ones here in case anyone is interested as well. So probably our most widely known is our annual IDF Advocacy Day. And this is when our volunteers advocate for the federal issues that impact the PI community. And as you can see in the picture there, this usually entails us going to Washington, D.C. and meeting with members of Congress in the Capitol itself, which is super exciting. Additionally, we have our health access advocates, and these are individuals who advocate for the PI community in their home state across the country. We have health access advocates in so many states, and they're a huge asset, so that's a great opportunity as well. As you know, we have our state advocacy workshops. We also have IDF action alerts, and as I said, this is a really easy and efficient way to get mobilized and reach out to your policymakers about both federal and state issues. And then lastly, we have the advocacy playlist. And this is a really great resource. It's a playlist of videos that we have to educate the PI community and the broader public as well about different health policy issues and advocacy tips, and other important things that we want to share. So really encourage you to check that out as well. And speaking of action alerts, we would encourage all of you, if you're not already, to sign up for IDF action alerts. It's a super simple process. You just go to the URL right there. We have a sign up for action alerts button. And then when you do the quick sign up, it'll just ask you for a few little tidbits of information. And then once you click save, you will begin receiving action alerts. So as we said, this is a really great way to make your voice heard and send messages to your legislator. So encourage everyone to sign up for those. All right, so now that we have gone through this information about the legislature, about the issue and advocacy in general, we are going to turn it over to Lincoln Clapper from Advocacy Associates. And he's going to walk you through the online portal that you're going to be using for the day of action to check out your meeting schedule and other tools that you'll be using.
Hi, my name is Lincoln Clapper, and I'm part of the Advocacy Associates team here in DC, and I want to spend a few minutes walking you through how to access your online portal to get your schedule for your state level meetings. Now, in order to get your schedule, please visit this site, clients.primeadvocacy.com/attendee/login. And you'll know that you got to the right site because you'll see a login module that I've taken a screenshot here to the left, where it'll be asked you to input your email address. And you want to go ahead and put the email address that you registered for this event with in that field. Click the blue continue button, and then you'll be launched into your dashboard. Please note that the email field is case sensitive. So if you have a space either before or after your email address, it may come up as invalid. So make sure that your email address is complete when you input that information. Now, when you're launched into your schedule, you're going to see a list of meetings, one after the other, and I want to walk you through what one of those modules looks like. Now, first, at the top of each meeting, in the upper right-hand corner, you'll see the status of that meeting. And if it's confirmed, it will be displayed as a green confirmed symbol, as you can see here. If it's still pending, we may be working with that office still and coordinating a time, you'll see it as pending. And you'll be able to see that for each of the meetings on your schedule. On the left-hand side, you'll see the date of your particular event or your meeting, and then you'll be able to correlate that with your schedule and verify. Beneath that will be the time of your meeting. Now, please note that this time is displayed in Eastern time, and this meeting time is the start time for your meeting. We are asking everybody to get into their meeting 5 minutes prior to the start time on your schedule, and I'll be reviewing that information here a little bit later, but please do note the time you see on your schedule is listed in Eastern time and is the start time for that meeting. Now, beneath that will be some information about the office you're going to be meeting with and who you'll be speaking with within that office. And so you'll see that legislator's name displayed in the office of field. And then in the meeting with field, you'll either see the legislator's name or one of their staff who you'll be speaking with. And the location field will be the information that you'll need to access your meeting. You can dial in with the appropriate dial-in information that's provided, or you can join via video. And so you'll know there's a video component for your meeting if you see a blue URL, if you see, as you can see in this example. Simply just click on that blue URL. It'll open up the meeting dashboard, the video component for that meeting, and you'll be able to talk with your legislator over video. Again, if you're not able to access via video, you can of course dial in, and so just follow the instructions that you see in this field. As you scroll down a little bit farther, you'll see some supplemental information like the party, the state, possibly the district of your legislator, relevant information about a special note that may or may not be included. But the talking point section below that will really encompass all the information that you'll need. You'll see some reminders there at the top that we like to put in there just to keep everybody on track throughout the course of the day. This seems to be where everybody's eyes tend to go first, and so we like to put those reminders in that area. You also see all of your talking points that IDF has supplied for this event. So you'll see that information displayed here, along with any documents that they'll be providing. So if there's any documents that are also supplemental to your talking points, they'll be in this section, and they'll be highlighted blue as well. They'll be hyperlinkable. You can click on those and download those and read up on those ahead of your meeting. There also will be a support number listed here. So if you have any technical issues or scheduling issues, you'll be able to contact our team directly through that information that'll be listed in the talking points section. Beneath that will be a list of the additional attendees who are in the meeting with you. If you do not see any names here, that means you are the only attendee in that meeting. Otherwise, the only names that you'll see in this field are additional attendees who will be joining that meeting with you. Then lastly is that there's a meeting notes section. This is an opportunity for you to record feedback, take some notes on how the meeting went. We'll be sending this information to the IDF team after your event. So please be as thorough as possible in terms of describing how the meeting went. Was it positive? Was it negative? Really any information at all. There's no character limit. We only ask that you refresh your page before inputting any data, just to ensure you haven't timed yourself out. Sometimes if you're logged in for an extended period of time without any movement on your schedule, the system may time you out. So just refresh your page, make sure you're still logged in, and then you can start recording those meeting notes. Once you conclude with the content, just click that blue Save Notes button, and then you'll see your page refresh again, and you'll see your content saved into that particular portion of your meeting. My last slide here, just some information to keep handy. Again, please get into each meeting 5 minutes prior to the start time on your schedule, whether that's dial-in or via video. We just want to make sure everybody's present when the office joins so the meeting can start right on time. All times, again, on your schedule are shown in Eastern time, so very important to keep that in mind as you're planning your day around these meetings. If an office doesn't join your meeting within 10 minutes past the start time, please contact us. There will be a help number in the talking points field, again, for you to call if there's any issues like that. Sometimes legislators and staff run late just like the rest of us, but please do give them a 10-minute buffer time to join before contacting us. Please know these meetings have been scheduled in 15-minute blocks. These may, of course, end early or go longer. Really important tip is to ask the office at the beginning of the meeting how much time they have, which will really steer you in the right direction. Please provide feedback again on how your meeting goes through the meeting notes section. Just remember to refresh your page before inputting any notes. Make sure you're in an area with good Wi-Fi connection, as again, most, if not all of your meetings will have a video capability to them. Please mute your microphone whenever you're not speaking, whether it's via dial-in on your phone or over your computer. And just know your audience, ensure you have an appropriate background throughout the course of your day. That being said, looking forward to a very successful event, and I will turn it back over to the IDF team.
Thank you so much, Lincoln, for walking us through the participant portal. If you have any further questions, whether it be about your participant portal, about the legislative process in your state, whatever it may be, please don't hesitate to reach out to us. You'll see our contact information there on the screen. You can also use the Ask IDF feature on our website if you have any questions at all before your day of action. Thank you and happy advocating.